Action. Action.
Adam,
Action.
move your foot or I'll break it.
Well, go ahead and
Move
break it then. Action.
He is busy.
Action. Will you come here for a second when you get done?
Could you please move?
3, 2, 1. A rough start to tonight's meeting as dozens of people, including the mayor of Belhaven, the NAACP's Reverend William Barber, and the media, were closed out of Pantego Creek LLC's meeting regarding Vidant Pungo Hospital, a meeting that was set to decide if Vidant violated its agreement with Pantego Creek, therefore leading to a lawsuit.
They don't want people to see what they're doing in there.
What the hell? I thought it was a public meeting.
I mean, it's always been open. They've always had guests. And Ellen Allen standing at the door, you know, doing her thing.
The business that they'll be doing will impact the public, but the public will not be allowed to see them do their business. They've not asked to speak. The public is simply asked to be present.
You can't come in.
Why is that?
Because it's a membership meeting only. This is just for the membership of the Pantego Creek LLC. We will vote tonight. That's why it needs to be a controlled, restrained meeting.
The explanation that I received was in essence that this needed to be a controlled meeting, as though the public is out of control. They're not out of control. They are very much concerned about who will control their future and who will control their health care. They have a serious interest. This is not about mere dollars and cents. It's about life and death.
I was disappointed in the administrators that have made this decision. I was disappointed that they would leave this area of the county, as well as Hyde County, without emergency services. If we get right down to it, people will probably die if the hospital closes.
I cannot imagine our town and our people being very well taken care of medically if we do not have a facility that can do the essentials to diagnose and manage these patients. Modification of health care is appropriate, but not eradication of health care.
Here's Belhaven. The existing hospital is right here on the western shore of Wynn's Gut. Here's the city of Washington, 30 miles by roads. From Belhaven to the main part of Hyde County, some 50 miles. That represents a long time because these roads are not good. Someone will have a serious injury in Hyde County, make it to Belhaven, and then transfer to the Belhaven ambulance to complete the journey to the Washington Hospital. The problem is, if you have a serious wound and you're bleeding, then if you can't stop in Belhaven and you have to go all the way, you have added huge increment of time. The ones who had serious injuries would die before they were tended to.
When you take patient care out of the scenario, you take people out of the scenario, it becomes a business decision.
It makes me sick to even think about what Biden is trying to do to us. And I feel like we're being mistreated. I'm 77 years old. It makes me feel bad when I start even thinking about what they're doing.
Vidant thinks that they can come into this little town in northeast North Carolina, this little coastal community, and take our health care and nobody say anything. Well, that's not the way it's going to be. If they were in good faith trying to do the best thing, they would be sharing their numbers with us with no reservation because there'd be nothing to hide. It would be like if you had a grocery store in Washington and one in Belhaven, and you knew that the people in Belhaven, if there was no grocery store, they had to go to Washington. Well, if you could get rid of the expense of having a grocery store in Belhaven and send all the customers to Washington, you'd make more money. The reason they're not sharing our numbers is because they're mixing in costs that aren't direct costs to our facility, and they're taking every worst case scenario possible to eliminate our hospital.
Wake Forest Baptist out in Winston-Salem was trying to do this, and there was a lawsuit over it. And the confidential business report actually spelled out, it said, we want to move the hospital because the population where the hospital is poor, largely African American, and uninsured. And we want to move it closer to Winston-Salem where people have insurance, and we want to move it to this Gulf community. And we thought this trend would stop with Medicaid expansion, and as you know, at least for this year, the General Assembly said we're not going to take Medicaid expansion. So we're going to still see this problem of hospitals wanting to relocate to areas where people are better insured.
They are after the dollar. That dollar is what they're after. It's not the people's lives. They really need to stop and think, because if they close this hospital, death is on their hands. It's by all these children around here. This hospital's got to stay here.
All right, here we go.
You're not coming in. You're not coming in.
Golly.
You said it right.
John, what's the deal?
Mary, Ari apparently has made a deal with these people so that the town